The root canal procedure is an often misunderstood dental procedure that can cause anxiety and fear in patients. There are a myriad of misconceptions regarding root canals. It is essential to separate fact from fiction to make educated choices about the health of your teeth. In this instructional video, we'll debunk a few of the most commonly held root canal myths and offer accurate advice on the procedures involved. Procedure. Irrefutable, root canals can be exceptionally difficult to heal. Truth. Although it's real that root canals carry an image of being uncomfortable, but the actual procedure can be no more uncomfortable than the filling. The pain that is associated in root canals is usually resulted from an inflammation or infection of the tooth, which calls for the process. When the affected tissue has been eliminated and the tooth cleaned and sealed, it should ease the pain. Patients generally report feeling better following the procedure is done. Myth: root canals cause illness. Truth: there is no science-based proof to back the idea that root canals can cause disease. The belief likely comes from research carried out in the beginning of 20th century. It has since been disproved. Root canals can be a reliable and efficient way of saving the tooth if it is afflicted or has been damaged. It is true that not treating a tooth that is infected may lead to more severe medical issues such as dental abscesses or systemic infections. Myth: that root canals aren't needed if the tooth doesn't harm. Truth: although it's certain that not all of the tooth canals hurt, however, it's important to treat the root of the problem before it gets worse. Teeth that are damaged or infected can be abscessed and result in pain and swelling. The problem is not going to go away if you ignore it. Solve the issue, and, in the majority of cases, the only method to preserve the tooth is to create an operation called a root canal. A regular dental exam can identify problems earlier and reduce the necessity for further procedures. Myth: that root canals are costly. Although root canals may be expensive, but they're typically protected in dental insurance. The long-term benefit is that the procedure of a root canal typically less expensive than taking out the tooth and then replacing it with a bridge, implant, or a dental bridge. The preservation of the tooth you have is an option that is best, since it can help maintain your dental condition and function. A lot of dental clinics also provide finance options or payment plans in order to make your process less expensive. Myth: that root canals weaken tooth. Truth: root canals will damage the tooth, but however, they can strengthen it by eliminating the affected tissue and then sealing it in order to stop further damage. Following a root canal, the tooth will usually be restored with a crown, which protects against fractures in the future or damage. By maintaining a healthy oral routine and regular dental appointments, teeth that have received a root canal may endure for a lifetime. Legend: root canals need many visits in order to be completed. Most of the time, root canals, the procedure can be done in the span of 1 or 2 visits to the dentist. The time frame for treatment is contingent on the nature of the problem and the degree of disease. When the root canal procedure is finished, you will be required to attend another appointment in order to confirm that your tooth has healed in a proper manner. The dentist will be able to provide instructions on how to take care of your teeth following the treatment. Root canal therapy can be an efficient and secure method to save teeth that has become damaged or infected. In debunking the most common myths about root canals and providing complete information on the process, we aim to dispel any doubts you have regarding root canals. Make sure you discuss any concerns you have with your dentist prior to any dental procedure. Dental health is crucial, as well as taking dental hygiene seriously can assist in preventing serious issues later on.